A place to care for the sick, but also a target in conflicts. To deliberately attack a hospital is considered a war crime, but such strikes against them have become increasingly common. This is a children's hospital in the Syrian town of Azaz, which was hit by 5 missiles on February the 15th last. 14 civilians were killed. Dr. Osama Abo El Ezz is a surgeon in a hospital in Sakhour, a district of Aleppo which is held by the rebels. He spoke, for security reasons, from a secret location about what he witnessed. They bombed the hospital in February 2014 with a rocket from a warplane that hit the side of the hospital. The regime bombed the hospital again between June and August 6 times with barrel bombs. The last 2 times they hit the building and destroyed parts of it. The hospital was out of service completely. In order to continue providing medical services, we had to go underground. On April the 27th, the Al-Quds hospital, also in an area of Aleppo held by rebels, was bombed, it's believed, by either Russian or regime jets. 27 people were killed, including the last paediatrician in the east of the city, Dr. Mohammed Wazim Moaz. But such attacks are not isolated cases, according to the Director of Communications of Médecins Sans Frontières in Syria.
We have no idea why this is happening, but with double-tap attacks, regular double-tap attacks, we know clearly that there's a strategy to reduce these facilities to rubble. Now, we've never heard about that before, where hospitals are such targets that local communities don't want access to healthcare. This is incredible.
The attacks have turned the universally recognised symbol of the Red Cross into a deadly target, which has exposed the failure of the international community to prevent and punish such crimes. US forces struck an MSF clinic in Afghanistan last year, killing 42 people. It was, said the Pentagon, a mistake. But MSF do not believe that version of events and has called for an independent inquiry.
The hospital building was repeatedly targeted several times in less than an hour, while no other building was hit around. So we do not have doubts that this building was targeted as such.
More than 80 hospitals and clinics supported by MSF were targeted in 2015 and 16, killing, it says, at least 100 people. Nearly 740 doctors and staff have been killed in attacks on hospitals in Syria in the last 5 years, according to the Physicians for Human Rights. The UN Security Council has denounced the attacks and demanded all parties in conflicts protect medical facilities, staff and patients.